What if I told you I knew how to help your child with autism? That I knew how to improve their socialization, speech, cognitive processes, and physical agility, starting today. Would you be interested? What if I told you that a child who's been blind since birth may have a chance at a life with vision, or that your little boy with cerebral palsy may run one day? Would you want to know how? What if I told you I knew how to improve health and well-being across the board? What if I told you I found the missing link?
I can see those black clouds rolling in, feel the fear creeping into my heart again. Sometimes life's like a ruthless fight you can never.
Sydney was born with a tumor on her spine, and she had it removed when she was 9 days old. And after that, she went through chemotherapy, and she was paralyzed from the waist down.
So when she was 12 weeks old, we finally had an MRI and an EEG and realized that she was having seizures and that she had global brain damage.
Most of the brain damage for him is in the occipital lobe. It's mainly cortical, very little of the gray matter was affected, but he was totally unresponsive.
Mia was born 29 weeks gestation, weighing 1 pound 4 ounces. She was severely intrauterine growth restricted.
My daughter Natalie was born with cerebral palsy and arthrogryposis. Her knees were frozen up, her hips were out of joint, so it impacts every joint and tendon really that she has in her body.
Specialist puts Parker on the table, checks a couple of quick reflexes and says, has anybody talked to you guys about cerebral palsy? And our heads kind of spun around on our necks 360 degrees and we went, what do you mean cerebral palsy? Cerebral palsy is those kids that are like this and they're bound up and they're in their wheelchair and they can't talk, and our little boy doesn't have cerebral palsy.
Start seeing signs that she was not verbal from the time she was like 13 months.
My son was diagnosed with Asperger's syndrome when he was 8, and my daughter has seizures.
At about 2.5 years old, he was diagnosed with autism, as well as having seizures.
And finally we got a diagnosis of autism. And I heard autism. I had no clue what autism was.
It was pretty dark for a while, for years, because what the doctors were saying is, one, we don't understand what this is. We don't know what the seizures are about. We'll try and control them with medication, but the medication just absolutely, he was out of it. So there was he was even less with us. Wow, whew, that was a hard time.
After he started to present with seizures, they gave him the phenobarbital and all these really hardcore drugs, basically not doing anything. The EEGs were really flat, and she basically told me he may not even breathe on his own. This may be it.
Then they said, this is a very, very small baby. We have a huge problem here. We don't know if she's gonna make it. This is not good.
We were told by doctors to expect her to be in a wheelchair, and she underwent lots of surgeries and casts until she was almost a year old.
The doctors told us Parker's probably not going to be a candidate for independent walking. We'll get him on his feet, we'll get him weight bearing, but just be prepared for the fact that he's probably always going to use some sort of adaptive device. So we thought, okay, well, I guess that's what we have to look forward to, is a bunch of limitations.
My son was 16. He was very profoundly depressed. He was on the floor crying. That's with meds, on anxiety meds. There was nothing we could do, ever. We tried everything that the medical community had for us.
Before the camp, Akhil would have a lot of anxiety behaviors, transition behaviors. If there is too much talking in the bus, he would have a tantrum. They would have to pull the van aside. They had to call us and we had to talk to him. I had a lot of marks on my hand, aggressing towards people, not able to handle himself.
He couldn't retain information. He couldn't remember from 1 second to the next.
Your daughter will never talk. Your daughter will be in an institution. And for me, it was really heartbreaking. And I felt like, okay, how can a person who's 50, 60 years old have cancer and they tell them there is hope, and my daughter's just 2 and you tell me this is what she's gonna get. So that was really a tough one. But I guess, for me it was a motivation because I just didn't want to listen to her. I said, I think there is other way.
The mountain's just too big to move.
They told him he wasn't going to walk independently. 18 months of work with the MNRI group, Parker took off walking. Now that we've been doing the MNRI program for about 5 years, Parker runs track, Parker plays football, he loves playing tag with his friends. So any of those things that they told us were not going to be possible, clearly are possible. And the list of no's doesn't even exist anymore. We don't know any limitations. This kid's going to go through the roof.
Before she turned a year old, we met Shannon and started MNRI therapy. Since then, she has learned to walk and run and dance and play and live life outside of a wheelchair.
Almost miraculously, she started swallowing the baby food puree. So we went from 0% eating by mouth to about 2-3 tablespoons within those first 3 weeks of starting the therapy. And then now we are a year and some change out, and she's 100% fed by mouth.
The first one in January and then in March. And that was the first time I had ever seen him visually track anything other than a light. He's looking at you. He's looking at you. We'll never forget it, but he looked at her face, and when she backed away, he followed her. And there was no denying that that was what was happening. And so she went to the other side of the table and got over him and then moved, and he followed her again. Again, like the waterworks.
She's made huge strides in the swallowing and the breathing, and the coordination of suck, swallow, breathe. She's made a lot of strides in her trunk control and head control in general, and then vision. We've seen a lot of changes positively in her vision. So she was diagnosed blind when she was 4 months old, and we brought her to another doctor because we said we want a second opinion. We don't believe it, and they said, yeah, we think that she's blind. Brain damage is tough, and cerebral palsy is tough. But the vision part was really hard for my husband and I. So it's really nice that we know that she can see us, make eye contact, smile. She knows the difference between mommy and daddy and big brother now. And it's a big thing because you need those little rewards.
Before the conference, his left side, which is his weaker side, was a lot shorter than his right side. Whenever he does physical therapy, he needed the heel lift, like this much. But now both of the legs are even, it's metric, so he doesn't need a heel lift anymore, which is great.
His feet grew 4 shoe sizes in 6 months after the first camp because we worked on the foot tendon guard. His feet were hard, and now they're soft, like they're becoming flexible. So I think every day that he walks, it's less stress.
This is his 3rd conference, and how many inches did you grow?
5.
5 inches in this past year. But for him, it's muscle mass, it's increase in muscle fibers, as well as the height. Like everything grows along with it. And no doctors knew what to do for that. They just had to feed him more.
He would just get really congested and start sneezing and coughing, and now he can be in environments. So I think his immune system, his nervous system, his autonomic nervous system.
So his textural issues have disappeared. His seasonal allergies have disappeared.
The MNRI method wired her, gave her her foundation, like wired her genetics so that her genetic path could take over. She didn't skip a beat in development. I mean, I hear from other preemie moms and even regular moms that she's just completely advanced, more advanced than they expect her to be.
I've seen kids who can't walk and run. I've seen other kids like Ian who are screaming down the halls and can't let anyone touch them. By the end of the camp, they are allowing the therapies happen. I see it all the time in every camp.
You became so big. Oh.
He's only 140 pounds, Svetlana.
I have no strength left to bring him on the
His
table.
articulation has improved since MNRI because we did speech therapy for like 10 years. 10 years, and because he didn't talk till he was 7.5, and then it's like the last 1.5 years of MNRI, the articulation errors just kind of went away on its own.
From being a child that didn't have any words to right now she's on a private school, dance, which is tap dancing and jazz. She's very gifted in piano. She plays things that, 18-year-old cannot even play.
So school saw a huge improvement. A boy who was typing at this level, which you saw him typing independently, he was in school at this level.
Bravo!
Scott, just this year, she just have a best friend, which has been like a new thing. Everybody wants to be her friend, but she doesn't feel comfortable to be social. And this is the first time she really have a friend that she's really comfortable with.
We now go to the park. He's now able to play with a bunch of other kids that he's never met before, which is amazing.
He would never accept friendship because he didn't feel that he was worthy of a friend. That was gone. So it's more than just a physical thing that this reflex therapy does. It also helps in how they perceive themselves and what they feel they can do, and then eventually what they can do.
I'm still in awe. He's been braver and stronger.
And first year of her life, she cried nonstop, just never stopped crying. And so for her to be so happy and so funny and such a great, silly personality is really nice.
He had surgery 1 week before, and we decided to come kind of reluctantly. Wasn't sure if he would be okay during that. His nervous system was so out of whack from the surgery. His eyes were jumping around. He was hypersensitive to everything, and within 2 days, his whole nervous system has changed in 2 days. Not just the entire camp, but just 2 days. His eyes are straight, they're steady. He's sleeping well. I'm so grateful we came. So
we've had now further progress with my daughter's spine, which is pretty scary, especially when she first started coming here, but she's just getting more symmetry, the spine's getting straighter, her torso's getting longer.
Immediately after leaving Orlando, we noticed some dramatic changes with Scott, particularly with his spine, his speech.
We've seen a couple of changes after the last one we did. Only end up. My hips are good now.
With bladder and bowel control, which we've conquered.
And he too similarly tried everything, it seemed like before, except nothing. And was in the processing speed of 7th percentile. Austin is the poster child for MNRI. We have a neuropsych, a WISC-4, from 4 months prior to when we ever came upon Svetlana Maskatova. 24 months, he has gone from a 107 to a 140, which is just completely unheard of.
A thing that comes from the central nervous system, doesn't it? And well, it needs to work with the skin and muscles so that, well, when there is a scenario that we need to act about immediately, the central nervous system takes care of it.
He's an absolutely wonderful pianist also. So I am very proud of his boy. And we stopped doing everything, and we only did Maskatova.
They, of course, want my daughter to have spine surgery, whereas Dr. Maskatova is straightening her spine without any blood, without any stitches, without any anesthesia, without any downtime. And she's doing it in a way that the body is willing to do it versus shoving, a rod down somebody's back.
And it was instantly different. Like, we had tried Banyel, we had tried, of course he was already in all the traditional therapies, the speech and the PT and the OT, but he cried every time he laid on the table for anybody to do anything. And so he laid down, and it was it was just different. He was different. Their connection was different. It was just a totally different experience.
We have done all sorts of different things with Mary Elizabeth. We've been all over the world with her, seen lots of different therapists, and tried a lot of different things that we have found MNRI about 13 months ago. She's done really, really well. We've seen some really amazing results.
We pay out of pocket for all of the alternative therapies that we do. Insurance has absolutely no interest in covering any of this stuff.
Anybody who walks around with a nervous system needs to have access to this type of information, even if it's just educational, to understand your body. And that is self-organizing, and with the right tools you can support it.
Going to be set up for a lifetime of care. You were going to put him on a lifetime of prescription medications. He was always going to need devices. He was probably always going to need help to survive after his parents were gone. We've taken all that away.
Now that I think of it, I wouldn't be walking unless they put me in this therapy.
No, it's a layering system. I feel like this provides that core foundational.
My belief has has always been that my daughter will be perfectly healthy, like her brothers and sisters. So it's just how I'm going to get there. So Dr. Maskatov is making that possible.
My long-run dream is I want him to walk and talk.
A huge thank you, and he really was taking it all in. And I'm thinking next conference that we're going to be done with seizures. That's the plan.
I not only knew that she was going to be okay, but she was going to be better than okay. And we just had to go through this hard period. But I saw an end in sight.
We had goals, and I was always going to get them there. I just didn't know how. So, but now I know how.
All these why questions, and it's like I feel when I come here, I have the answers as to why.
We definitely see a better future for Mary Elizabeth, and we've always had hope, but now it's more realistic, if that makes sense. So we're starting to see some fruit of our labor, and we're starting to see some positive changes that we think we can build on.
Where everyone was saying, we don't know the answers, this really provided that new potential.
It's a really uplifting journey in a situation where obviously it could be very, very depressing, very frustrating. So it's, overall it's an amazing journey that I'm lucky to be a part of.
He said, I want to thank all of you. You touch my heart and give me hope.
Do you ever want to be an MNRI core specialist?
Maybe.
Do you think you'd be able to help other people?
Of course. I'll always be happy to help other people. It's about helping, after all.
But we are on the pathway for integration of reflex patterns versus traditional inhibition. And we want many parents, adults, professionals to know how to address, how to treat this biggest gift from God, from nature, in order for our kids, minute after minute, hour after hour, day by day, to become stronger. If they're nonverbal, to start their speech development. If it was difficult for them to move, to crawl, to stand, to roll over, to walk, to reach maximum what is possible at this moment. And we want to show with our techniques, things are possible. Things are possible.
Just when you think I can't take no more, I come back stronger than I was before. 'Cause when I'm down in the dust, I know I'm gonna rise up even higher. A fighter. A fighter. Found that the moment I got nothing